This is the Caring for Burns skill. Because the skill involves patient care, gloves must be worn. In fact, PPE is critical when treating burns, not only to protect yourself, but because they present a severe risk of infection. The most common causes of death for burn patients are infection, hypothermia, or drowning secondary to pulmonary edema. So it is important we do not introduce additional contaminants. For large areas of burns, we would actually just use a sterile burn sheet. In this case, the patient has a relatively small area of burn on the right lower arm. Because burns can swell significantly and quickly, we're going to start by removing any jewelry or clothing on the limb with the wound. While one partner does this, the other partner will make a quick estimate of the body surface area burn. This square is blistered, so we would say about 1, maybe 2% max of second-degree burn. The primary provider will place her hand slightly above the wound to feel if it is hot enough to still cause additional tissue injury. If the wound is so hot that it is uncomfortable against your palm, tissue damage is still occurring. In this case, we would pour sterile water or saline over the wound until it was no longer painfully hot before dressing it, creating an effective moist dressing. Moist dressings have serious consequences to the burn patient, however, and should only be used when the wound is so hot, active tissue damage continues. In this case, the wound is not hot enough for that to occur, so we can use the preferred dry, sterile dressing. Being careful to minimize contamination, we're going to put multiple layers of sterile gauze completely covering the wound, avoiding touching the wound or its margins with our gloves, tape, or any non-sterile surface. In some cases, you may need to overlap gauze to cover the area to ensure there are no gaps. In this case, a 4x4 or 2 will be sufficient. Be careful while placing it to not burst blisters as possible, as this dramatically increases the risk of heat loss and infection. Again, because infection is such a serious concern, we do not want to use adhesive on burns if it can be at all avoided. We're going to wrap with gauze loosely. Again, burns do swell quickly and severely. Even moderately tight bandaging can rapidly become a tourniquet if we're not attentive. As loose as possible while still sealing the wound. Frequent PMS checks distal to the injury. Avoid covering the limb completely so that you can tell if swelling begins.
Can you feel me touching you? Can you wiggle your fingers?
At this point, we're going to minimize movement of the limb that could cause additional tissue damage, treat any other additional injuries. We want to prevent heat loss. If this was a large area burn, we would completely cover the patient in a burn sheet and then stack multiple blankets on them before applying oxygen. With this relatively small injury, we'll keep the patient covered to comfort, avoid the wound getting excessively cold or getting any kind of wetness or contamination. Pain is a significant concern with second-degree burns. If your transport time was to be prolonged, it is entirely acceptable to call for ALS Intercept solely for pain control in this setting. The skill is now concluded.